Today we're diving into something, well, pretty profound, a really transformative journey. It brings so much joy, but also some pretty significant physical changes. We're talking about understanding and managing the, let's say, common discomforts of pregnancy. Yeah, our goal here is to really pull out the key insights, to help you navigate this time of, well, huge physical shifts. We want to get a handle on what's like typical, what might signal something else, and crucially find some practical ways to cope with all the aches and pains and other stuff that often comes up. So if you're pregnant right now, or maybe thinking about it, or maybe just curious about this whole incredible process, well, this deep dive is really for you. We hope it helps you feel a bit more informed, maybe more prepared for the physical side of things.
It's so true. That phrase, pregnancy discomforts, it just clicks instantly for anyone who's been there, right? I mean, we know about the big physiological changes, but actually living through it day to day, that takes patience and, well, some good strategies.
Okay, so it sounds like discomfort isn't just like a possibility. It's actually pretty normal for a lot of people. Why is that?
Fundamentally, it's because your body is doing something absolutely extraordinary. It's working incredibly hard. To support that growing fetus, your body just goes through these massive shifts. Hormones are surging, your blood volume increases dramatically, and just the physical effort involved, carrying and growing a whole new person, understanding the why behind it all can be really empowering.
Empowering how?
Well, not just for coping day to day, but also for knowing your own body, recognizing when something feels off, when maybe you need to check in with your doctor.
Right, gotcha. And these discomforts, they're not the same the whole way through, are they? They really change as the pregnancy goes on. Let's maybe walk through that, like trimester by trimester.
Yeah, definitely. It makes sense to look at it in stages because the common issues often follow that pattern. So in the first trimester, that's up to about week 13, things are really dominated by those early hormone shifts and that boost in blood volume. This is when a lot of people feel just wiped out, overwhelming fatigue. Mood swings can happen, breasts feel tender, headaches pop up, and of course nausea, that morning sickness that, well, isn't always in the morning.
Yeah. Definitely not just mornings for some.
Exactly. And needing to pee all the time, that starts early too. Then you move into the second trimester, weeks 14 to 27. For many, there's often a bit of relief. That intense fatigue might lift. Nausea often gets better.
Okay. Bit of a breather, maybe?
Sometimes, yeah. But as the fetus grows quite a bit bigger, new physical stuff starts happening. You might start feeling different aches and pains, from the pressure and stretching. Swelling can begin, maybe some stretch marks start appearing.
And then the third.
The third trimester, so weeks 27 to 40. This is often the most physically demanding stretch, the baby's heaviest then. And that puts serious pressure on everything, your joints, your bladder, your digestive system. So you can get more pronounced aches, heartburn becomes common, constipation, maybe more bladder control issues. And feeling short of breath is pretty typical too because the uterus is pushing up against your lungs.
Okay, that's a great overview of the journey.
Yeah.
So now, let's really zoom in. Let's talk specific common discomforts and, importantly, those practical coping strategies we found.
Absolutely. Let's start with fatigue. We mentioned it's big in the first and third trimesters, often better in the middle. But here's something really interesting. Sometimes that extreme tiredness isn't just, pregnancy tired. It might actually be a sign of anemia.
Anemia, like low iron.
Yeah, low red blood cells. Could be low iron or maybe folic acid or B12.
So for fatigue, whether it's anemia related or just pregnancy fatigue, what helps?
Well, the main advice is really about prioritizing rest. Trying to stick to a regular sleep schedule. Same bedtime, same wake-up time can help regulate things. Short naps, definitely good, but maybe try to avoid them too late in the day, like after 3 p.m., so they don't mess with your nighttime sleep.
Right.
And because of that potential anemia link, getting your blood count checked by your provider is a good idea, usually early on, and then again later in the pregnancy. They can guide you if you need treatment.
Okay. How about headaches? Another really common one, especially early on, right? Probably those hormones and blood volume again.
Exactly. Hormones, blood volume increase, but also stress, maybe not drinking enough water, lack of rest, those can all play a part.
So what can you do?
Often simple things work. An ice pack on your forehead or the back of your neck feels good. Making sure you're drinking enough water is huge. The recommendation is often around 10 to 12 glasses a day.
10 to 12. Wow, that's a lot.
It is, yeah. Your needs really increase, and just resting in a quiet, dark room can sometimes do the trick. One important point. Be careful with pain relievers. Acetaminophen, like Tylenol, might be okay, but always always check with your provider first.
And if they're really bad.
Yeah, if they're severe or just won't quit, definitely call your healthcare provider.
Okay, now for the big one. Nausea and vomiting, the infamous morning sickness. Affects what, up to 70% in that first trimester? Though it usually gets better later on.
It does, usually. So managing it often comes down to diet and hydration. Bland foods are your friend here.
Like the brat diet.
Exactly. Bananas, rice, applesauce, toast, broth, baked potatoes, things that are easy to digest. Definitely try to avoid greasy or spicy foods. Hydration is key, even if it's just tiny sips all day long. Water, maybe some fruit juice. Ginger tea can be helpful, but avoid caffeine.
Timing meals helps too, right?
Mm-hmm. Eating something dry like crackers before you even get out of bed. Small, frequent meals or snacks every couple of hours rather than big meals. And maybe a protein snack before bed.
And supplements. I've heard about B6.
Yes, vitamin B6. And, just figuring out your triggers and avoiding them. But here's a really critical point. If the nausea is so severe you just can't keep anything down, food or fluids, that could be something more serious. So if that's happening, you absolutely need to contact your provider right away.
Got it. Let's shift to breast changes. Tenderness, getting bigger. That can start really early, like 6 to 8 weeks.
Yeah, very early. You might notice veins looking more blue, nipples getting darker, maybe even a bit of leakage that's colostrum starting in the second trimester.
All normal prep work.
Totally normal. The main thing is comfort and support. Good supportive bras are essential cotton, wide straps. Maternity or nursing bras are designed for this.
And the leakage.
Nursing pads can help manage that. And just gentle washing warm water is fine. No need for harsh soaps.
Okay. Moving on to more general pain and discomfort. You mentioned hormones, loosening ligaments, plus the extra weight. That causes strain, right?
For sure. It can show up in different ways. Sometimes sharp pains in the abdomen just from tissue stretching. There's also round ligament pain, that sharp jab in your belly, hip, or groin area often pops up in the second trimester.
Ouch.
Yeah. And leg cramps, especially at night, are really common later on. And backaches, well, that makes sense with the added weight pulling your posture forward.
So lots of potential aches. What helps across the board?
Well, it's interesting. A lot of the advice overlaps. Gentle, regular exercise is good. Staying hydrated helps muscles. Finding comfortable positions is key.
Like what?
Well, don't stay in one position too long. Elevate your feet when you sit. Sleeping on your side, maybe with a pillow between your knees, can really ease pressure on your back and hips.
Support helps too, I imagine.
Definitely. Lumbar pillows for sitting, maternity belts for belly support, comfortable shoes, low heels are best, and even compression socks or support hose.
What about heat or massage?
Yes. Hot water bottles, heating pads, warm baths, gentle massage, those can all help relax tight muscles. Also, making sure you get enough electrolytes and calcium, think milk, broccoli, cheese, along with your prenatal vitamin can sometimes help with cramps.
Simple things matter too, like how you lift stuff.
Absolutely. Bend your knees. Proper body mechanics are vital. And if back or pelvic pain is really persistent, seeing a physical therapist could be a great option.
Okay, how about swelling and varicose veins? They often seem to go together.
They do, yeah. It's largely about pressure from the growing baby slowing down blood flow from your legs back to your heart. That causes fluid buildup, leading to swelling or edema, mainly in the legs and feet. And that same pressure can make leg veins enlarge and swell. Those are varicose veins.
Usually later in pregnancy.
Often appear in the second trimester, yeah. And they usually get better after the baby arrives.
So similar advice to the pain management.
A lot of overlap again. Comfortable shoes, definitely. Support stockings or compression socks are really helpful for circulation. Stay hydrated, but maybe watch the super salty foods. Elevate your legs when you can. Try not to cross them. And keep moving. Don't sit or stand for too long in one spot.
Is there a point where swelling is concerning?
Yes. If you have severe swelling, especially if it doesn't go down with rest or if it comes on suddenly, particularly after 20 weeks, that needs immediate medical attention. It could be a sign of preeclampsia.
Good to know. What about bleeding gums and nosebleeds? Sounds uncomfortable.
Yeah, it's that increased blood flow, again, putting pressure on delicate blood vessels. Gums can get swollen, bleed more easily, raises the risk of gingivitis, and nosebleeds affect maybe up to 20% of pregnant people.
Anything to do about those?
Staying hydrated helps generally. For nosebleeds specifically, a humidifier can keep the air moist, maybe an extra pillow to elevate your head at night, and saline nose drops if things feel really dry. And for your gums, just really good oral hygiene brushing, flossing, seeing your dentist regularly, that's key.
Okay, let's talk skin changes.
Yeah.
Hormones and stretching seem to be the culprits here, especially later on.
Mostly, yes. You get things like stretch marks where the skin just can't keep up with the stretching common on the belly, breasts, hips, thighs. They usually fade but don't disappear completely.
Mm-hmm.
Then there's melasma, sometimes called the mask of pregnancy. Harmless, darker spots or patches, usually on the face or sun-exposed areas, affects quite a few people, maybe up to half, and typically fades after pregnancy.
Right. And the dark line down the belly.
That's the linea nigra, usually shows up in the second trimester and also fades over time. And acne can flare up or even start because your body's producing more oil, often noticeable in the first trimester.
So can you do anything about these skin things?
Well, you can't prevent them all, but good skincare helps. Gentle cleansing, oil-free moisturizer, and definitely sunscreen always important. Eating foods with vitamin C and E might support skin health, and stay hydrated again. Avoiding caffeine helps here too.
What about acne medicine?
That's crucial. Check with your provider. Many common acne treatments are not safe during pregnancy.
Got it. Okay. Feeling unsteady, dizziness. That seems like it could be risky, especially later on.
It can be, yeah. Feeling lightheaded or unsteady is pretty common, especially in the second and third trimesters, and the main concern is the risk of falling.
How to manage that?
Try not to stand still for too long, keep moving a bit. When you get up from lying down, roll to your side first, then push up slowly. Same idea when getting up from sitting, go slow. Avoid sudden movements.
Makes sense. What about those uterine tightenings? Braxton takes contractions. They can be a bit alarming if you don't know what they are.
They can. They often start around the 4th month or so. Your uterus muscles just tighten up and then relax. But the key difference from labor contractions is they're usually irregular, don't get stronger, and don't get closer together.
So they're normal, like practice.
Exactly, a normal part of pregnancy. If they feel uncomfortable, often just changing your position helps. Walk around if you've been sitting, or rest if you've been active. Relaxing things like a warm bath or reading might help too. Sometimes emptying your bladder can ease them.
But when should you worry about contractions?
Okay, this is really important. Call your provider immediately if you have severe pain, if the cramps just don't let up. Or, and this is critical, if you're less than 36 weeks pregnant and have contractions along with bleeding or constant back pain, those could be signs of preterm labor and need urgent attention.
Right, absolutely crucial distinction. Let's talk bladder issues. Urgency and bladder control problems. Needing to pee constantly, maybe leaks. Common, right?
Very common, especially early on with hormones and blood flow. And then again, late in the 3rd trimester when the baby's pressing right on your bladder. Little leaks, sudden urges happens a lot, usually gets back to normal after the baby arrives.
Can you do anything in the meantime?
Yes. Kegel exercises are highly recommended. Strengthening those pelvic floor muscles really helps with control. Some people also try bladder training, kind of consciously stretching the time between bathroom breaks, very gradually.
Is there a time to call the doctor about urination?
Definitely. If you feel burning or stinging when you pee or just this constant urge even right after you've gone, that could be a urinary tract infection, a UTI. Those need to be treated right away. And here's a super important point for you listening. Don't cut back on fluids hoping you'll pee less. Staying well hydrated is absolutely vital for you and the baby.
Okay, good reminder. How about vaginal discharge? Changes there are normal too.
Yes, an increase in secretions is totally normal. It's due to increased blood supply and those hormones again. Normal discharge is usually white or clear, shouldn't be irritating, and shouldn't have a strong smell. It might look a bit yellow when it dries on underwear. It's actually a sign things are healthy down there.
So the key is knowing what's not normal.
Exactly. Knowing the difference between normal discharge and signs of infection, and resist the urge to douche or overwash that can mess up the natural balance. Just gentle cleaning with soap and water is enough for the outside area.
What are infection signs?
Call your provider if you have itching or irritation, or if the discharge smells bad, looks bloody, is really thick or frothy, or is yellow or green. And some basic protection tips. Avoid douching. Wear breathable cotton underwear, always wipe front to back, and shower after you exercise or sweat a lot.
Makes sense. Heartburn or indigestion, that burning feeling. Seems like almost everyone gets that later on.
It's super common, affects more than half of pregnant women, especially in the 3rd trimester. It's stomach acid backing up into the esophagus.
Ugh. What helps?
Similar ideas to managing nausea, actually. Smaller, more frequent meals are often better than big ones. Avoid the triggers: spicy food, greasy food, sometimes acidic things like citrus or tomatoes. Some people find dairy helps, like yogurt or non-fat milk, maybe coats the stomach.
In positioning.
Yeah, try not to lie down for 2 or 3 hours after eating. And when you do lie down, prop your head and upper body up with extra pillows. And again, with antacids, check with your provider. Some over-the-counter ones aren't recommended during pregnancy.
Okay.
Eh.
Constipation, another fun one. Hard to go, feeling blocked up. What causes that?
Several things contribute. Hormones slow things down, the iron in prenatal vitamins can be binding, and later on, the baby's weight presses on your bowel. Can start early, but often worst in the third trimester.
Solutions. More fiber.
Fiber is key, yes. Aim for about 25-30 grams a day, whole grains, fruits, veggies, and fluids are absolutely critical here too.
Like a 10-12 glasses of water you mentioned?
Yes, and maybe even add 1 or 2 glasses of fruit juice, like prune juice, daily. Your fluid needs are just so much higher. Regular exercise, even just moderate walking, 20-30 minutes a few times a week, helps get things moving too.
And if that's not enough?
Then talk to your provider about safe options for laxatives if needed.
And constipation can lead to hemorrhoids, right? Those swollen veins.
Exactly. Pressure from the baby, plus straining if you're constipated, are the main culprits. They're common, especially later in pregnancy, and can be pretty painful.
So preventing constipation helps prevent hemorrhoids.
That's the best strategy, yes. If you do get them, try hard not to strain when you have a bowel movement. Avoid putting extra pressure down there. Don't wear super tight clothes. Try not to sit or stand for really long stretches. Lying on your side can help.
Anything soothing.
Yeah, things like pure aloe vera gel, coconut oil, or witch hazel pads can feel good. And hot or cold treatments like ice packs or taking a warm bath or sitz bath can ease the discomfort.
Okay, last one on our list. Trouble sleeping. Insomnia. Especially common in the third trimester, which makes sense with all the discomforts.
It really does. And getting good rest is so important. It helps manage so many other symptoms.
So how do you actually sleep when you're uncomfortable?
Well, applying all the tips we've talked about for other issues helps managing fatigue, bladder control, finding comfy positions for joint pain, some extra things to try, maybe some gentle stretches or meditation, a warm shower or bath. Keep your bedroom environment really conducive to sleep, quiet, dark, cool temperature.
Pillows. And your pillows are key.
Pillows are your best friend. Use lots of them for support. Under your head, under your belly, behind your back, between your knees, whatever feels good. Sleeping on your left side is often suggested because it might improve circulation.
What about sleep meds?
Definitely don't take any sleep medications, over the counter or otherwise, without talking to your provider first. They need to advise on what's safe. You know, as we've gone through all these, what really jumps out is how interconnected everything is.
Yeah.
Like hydration comes up again and again. Positioning. Managing constipation affects hemorrhoids and sleep sometimes. Getting enough rest impacts fatigue, mood. It's all linked. And so many of the coping strategies are similar across different problems, aren't they?
That's true. So what's a big takeaway here for someone listening who's going through this? It sounds like you're not powerless.
Absolutely not. There are real practical steps you can take based on what we've discussed to manage a lot of this. And maybe the biggest thing is listen to your body, pay attention, and keep talking to your healthcare provider. Open communication is key.
Right, because understanding what's generally considered normal discomfort helps you know your own body better.
Exactly. It gives you more confidence to recognize, okay, this feels like a normal pregnancy thing versus, this feels different. Maybe I should call my doctor.
Okay, so we've taken quite a deep dive today into navigating these common pregnancy discomforts. We've covered a lot, from that early fatigue and nausea right through to the later aches, swelling, sleep issues.
And we've really highlighted that, yeah, discomfort is common, but it's not necessarily something you just have to grit your teeth and bear. There are strategies, and maybe most importantly, knowing those signs, knowing when to reach out for medical advice is just crucial for your health and the baby's health.
And remembering, of course, that while lots of people share these experiences, your own journey through it is unique. So maybe a final thought for you to consider. Given this huge range of what's considered normal physical change and discomfort during pregnancy, how does focusing on recognizing these things and learning how to manage them actually empower you? How does it help you approach this significant physical journey with maybe a bit more confidence, more presence? Keep listening to your body, and really don't ever hesitate to reach out for support when you need it.